Great. Thank you so much, Tony, and welcome everybody to our YOR3 informational webinar. We're very excited that the request for applications is out and that we have the opportunity to have some additional grantees for YOR California. The schedule for today, we're going to have a couple of different welcomes, and then we'll talk a little bit about YOR California in general and YOR California 3 specifically, review some of the elements of the funding opportunity, take you through the application and the process for how you would go about applying, including the application itself, the online portal, and then also the budget template, which is a separate Excel document. And then we will also talk about, we'll have some time for you to post questions in the chat box. If there are questions that are easily answered, we'll answer them now. Otherwise, we will respond with answers as quickly as we can. And then we will talk about kind of the next steps and close. So that is the schedule for today. Let me go ahead and introduce you all to Jessica or Jessie Naselo, who is our program officer from the Department of Healthcare Services, to say hello to everybody, because I think most of you have not met Jessie yet. So turn it over to Jessie.
Hello, everyone, and good morning. My name is Jessica Naselo, or Jessie. And I am the project manager for the YOR California 3 project, which is under the MAT expansion project funded by State Opioid Response. Funding received from SAMHSA. I'm very happy to see how many people are currently in the webinar. This is a very beneficial project, as youth and young adults are such a vulnerable population, not only in California, but overall. So I'm very excited to see you all here and excited to look over your applications once submitted.
Great. Thank you so much, Jessica. Really appreciate you coming and looking forward to working with you in this YOR3 period as well. And let me go ahead now and turn it over to Victor Kobler, the Vice President of CIBHS and Principal Investigator for YOR California. And you're muted, Victor.
Okay. Good morning, everybody. Thanks for joining us. This is our informational webinar on the RFA for YOR3. And what we are looking for here are organizations that have both the organizational wherewithal and the that inner spark, that little flame there that convinces us that they are ready, willing, and able to make a difference in the lives of high-risk youth and young adults here in California. We want to make sure these organizations who are able to engage and retain high-risk youth in their service mix, whether that's treatment or early intervention or something else that's creative and effective, that they are able to provide access either within their own four walls or by referral to another provider to medication-assisted treatment, and finally to prevent overdoses. You may have seen the data where the rate of overdose among young people is, increasing dramatically, more so than any other age group, the group that we're focusing on here. And that's kind of thing. We want to stop young people from dying. And you're the people we select will be folks that we have the most confidence in their ability to do so. So thanks once again for being here. Our purpose is to walk through the RFA documents and process and answer any questions you may have. And so I will stop talking here and we'll get on with it. So Deb, back to you.
Great. Thank you so much, Victor. And I really appreciated that conversation around both the competency and that spark or the passion around addressing the needs of youth who are misusing opioids and stimulants and how important that is as well, and building the system and expanding access. So just a note, there is a question and answer box. And if you click on that, you can post questions at any time during this session. The low-hanging fruit questions that we know the answers to right away, we will answer today. Other questions we will take back, and we may need to consult also with the Department of Healthcare Services, and we will create answers and post them on the website along with the recording from today. So go ahead and put those questions in at any time throughout the session today, and you can also email questions later, and we'll tell you a little bit more about that. So YOR California Youth Opioid Response, as Jesse said, is part of the California MAT expansion project, and really has the purpose of expanding access to services for youth who are misusing opioids and stimulants, or at risk of overdose death, have opiate use disorders. And part of this is really the realization that for youth ages, and we define youth as ages 12 to 24, but that there is not as much access to medications for addiction treatment as there's needs for that for adults, but there's even less access for youth, especially services which are provided that are youth relevant. So this slide has kind of the vision and goal of YOR California, that we work in partnership with stakeholders throughout California to reduce the impact of the opioid and stimulant crisis on youth and families. YOR California is committed to enhancing and expanding access to youth relevant outreach, medications for addiction treatment, and other prevention, intervention, treatment, and recovery services. And its framework is based on key principles, which I'll share on this next slide, and are available on our website. So serving youth is different than serving adults, and we are looking for grantees who are able to reach and engage youth in these kinds of services. And we've identified these following principles. You can take a look at them at the website that drive the YOR California project, both our work as well as the work of grantees on the YOR California project. Before I go further, let me also just acknowledge that you've met Victor briefly, Lalaine May or Lala Oliveria Viafana, who is the project director for YOR California. I serve as a senior advisor now. You will hear from in a little while, as well as Amanda Helgetta. And we also have several other members of our YOR California team with us today, even though you won't be seeing them. I want to just acknowledge Candace Russell, who is our lead for TA, Ellen Radis, Yvonne Frazier, Phyllis Coletta, Liz Stanley Salazar, one of the original co-creators of the YOR California program, Ashley Durrell, Phyllis Coletta, and then also just thank Shaban and Tony Pacas for their help in producing this webinar today, because it really does take a whole team. So we work with other stakeholders as well as grantees, but we also have a team of people who are working on supporting grantees as well as other efforts within the YOR California project. So principals, key staff members, and really trying to do a lot of work with you all. This graphic, which is also included in the RFA, provides an overall glance at the YOR California service model, really looking at being that youth relevant, taking into account positive youth development and the comprehensive services that benefit youth. I'm not going to go step by step through this model, but know that this is really an important part of what we're trying to create for YOR California in terms of building that access, that it addresses harm reduction, positive youth development, is culturally competent, age appropriate, trauma informed, pays attention to entry for youth who are not, who are hard to reach and engage, who don't automatically get access into our service systems, paying attention particularly to some of the barriers related to health disparities, diversity, equity, and inclusion, providing that array of services either through your agency or also through your partnerships that are sort of the right size, the right types of services that youth need, and then providing some of the ongoing support, advisory groups, opportunities within schools, overdose prevention, skill development to keep youth engaged in recovery. So thinking about that overall model of YOR California as you're thinking about what it is that you might want to do as a YOR California grantee. So YOR 3 RFA at a glance. Let me first tell you that if you're interested in what other grantees have done with YOR 1 and YOR 2, that information is available on our website. And for YOR 3, previous YOR grantees are eligible to apply, as are new organizations who have not received funding through YOR California. This year we have $12 million are available, and the funding period will be, I believe, April 1st through May 31st, 2024. So it's about a 14-month period. We have two different kinds of grantees. We have implementation grantees and capacity building only grantees. So we call the second one capacity building only because we recognize implementation grantees will also be doing some capacity building, but they also, implementation grantees, build that service system to address the needs of youth and increase that access and deliver direct services for youth and young adults who are misusing opioids and stimulants. There is no minimum set on any of the YOR grantees, but for the implementation grantees, the maximum award we would consider when you're thinking about your budget, the maximum award will be $750,000. We think that the average awards will be closer to $500,000. And many awards will be less than $500,000. So that's in terms of the implementation grantees. For capacity building only grantees, they will really focus on how they can build the capacity of themselves and their partners to better reach and serve youth who are misusing opioids or stimulants, but they are not being funded to do the direct services. Most of the capacity building only grantees will receive about $50,000 for projects that build the capacity with their own organization and their communities. But there are also some additional funds that are available because some organizations may be building capacity of other organizations across the state, and they're also eligible for capacity building only. So this is kind of the at a glance. Going into a little bit more detail in terms of the implementation grantees, I think this slide pretty much says what I just said, but really paying attention to both the delivery of services and building your ability to deliver those services. Part of what that means that we will be looking for in these applications is the ability, we often talk about going upstream for prevention to find youth and to address services before a problem becomes too significant. For YOR California, we're actually asking you to go downstream and really work on reaching those youth who already have significant issues with opioids and stimulants and sort of bring them into the service systems and help them establish the hope and the skills and the medications that they need in order to be able to move forward. So thinking about kind of what you're going to do in terms of increasing the capacity and outreach to really reach those and serve those youth. There is some level of creativity in the ability to deliver kinds of services that you're aware that youth need. And advisory boards are also a great way to get some of that information about how can we better reach youth, what kinds of services do we want to try and adapt or utilize that are best practices to really help youth in moving towards recovery. We also recognize that for the most part, we can't do this alone, and we really want to pay attention to what kinds of partnerships you're building with youth, with young adults serving organizations. So oftentimes we have health, we have more traditional substance use disorder treatment kinds of services, and then we have youth-specific kinds of organizations working together in the delivery of your services. And then this also pays attention to different kinds of settings. We've had several grantees develop drop-in centers as a way of engaging youth, building transition age youth specific groups that are part of an addition of a medication assisted treatment kind of program, but really allowing the youth and young adults to work together. And then youth specific recovery support programs, building your workforce competencies, and sort of thinking about how you can also sustain what you're doing over time. I'd say are two other parts of what is particularly important in terms of the implementation grantees. Capacity building grantees, as I said, the capacity building grantees are not about providing direct services, but building the capacity of your service system to reach and engage and provide the services for youth. So sometimes we have projects which are focused on coalitions. Sometimes it's an organization that has the ability to deliver medications for addiction treatment, but has not figured out how to provide those services for younger people and what special skills and knowledge they need. And then also statewide or specialized organizations that are looking at building the capacity across the state are also eligible to apply as capacity building grantees. In the RFA, there are some examples of allowable activities in both of these areas. To be eligible to apply to YOR California, any nonprofit or for-profit business entity in good standing and authorized to do business in California, and this does include government entities, schools, school districts, nonprofit organizations, anyone who is able and authorized to do business in California is eligible to apply. We will be looking in the review process that you have the ability and you demonstrate that you can increase youth access to overdose prevention, MAT, and other treatment recovery services, and that you also have the capacity and you will be responsible to the contractual obligations and have a good record of sound business integrity. If you have more than one organization applying together, you will need to apply with one lead agency. And I see somebody has just put a question about FQHCs. FQHCs are eligible as long as they are eligible to do business in California. FQHCs are a great example of the kinds of organizations that often apply. And so that's what we have for eligibility. In terms of the requirements, you will have a contract with the California Institute for Behavioral Health Solutions. You will be expected to implement the project that you describe in your application. This means that if you say that you're going to be reaching and delivering MAT to 1,000 young people, that we will be expecting that you really do have the ability to reach and provide MAT to 1,000 people. That is a lot of young people to reach and provide medications for addiction treatment to. So do think about what your capacity is going to be as you are developing that application. There is some learning collaborative meetings and other TA. Do make sure in your budget that you allow for travel to at least 2 in-person meetings for the staff and partners to be able to attend. And of course, you'll have to be meeting state and federal program, financial and reporting requirements. And this includes 42 CFR Part 2 regarding confidentiality. And then also the Government Performance and Results Act data collection requirements. We do GIPRA assessments for individuals through the implementation grantees as a part of this because it's SOAR funding. So I've just given you a whole lot of information about the overall pieces of YOR California. Almost all of it is available also in the RFA. And I'm going to now turn it over to Lala, the project director for YOR California, and she will review the application.
Thank you, Deb. Hello and good morning. Again, my name is Lalaine May or Lala, and I will be briefly reviewing the application and its contents before I hand it over to Amanda, who will provide the walkthrough of the entire application. Alrighty. So the completed applications are due by 5 p.m. on January 19th, 2023. Please ensure that all the attachments are correct, and please try to avoid submitting right at the last minute, just in case there are any hiccups in that process. So our team will be able to provide the support that you need in the appropriate time frame. All of the instructions to complete the form and upload the attachments are included in that online application on that portal. And you'll be able to work on the application and upload the attachments and then save your work and then return it to it if you need to at your convenience. But once the application is going to be submitted, there unfortunately would be no opportunity to change it or make any additional changes to the application or the attachments. Upon submission, after signing the attestation at the end of the application, your screen will say thank you, and then you'll receive an email confirming your application's receipt. So next, in the application components, there are different types of applications that will auto-generate based on the answers provided in section 0 of the application, which I will go over in a little bit. One will be for new implementation grantees. One will be for a previous grantee applying to be an implementation grantee. One will be for a new capacity building application, and one for a previous grantee applying to be a capacity building only grantee. The different applications will have minor differences in questions and the required answers for the application. Next, I apologize. Alrighty, so although there are different applications, all of the applications will be worth 100 points. Points will be determined by if the questions were answered in its entirety, so each part of the question are answered and complete, the quality of the answers, and the relevance to YOR California's goals and target population. We have section 0, the application overview that requires fill-in information of the organization. And this is also the section that asks if the organization is a previous grantee and if the organization is applying for the capacity only building grant. In section 1, there will be required narratives, fill-in information, and data, including the ability to upload the resumes and optional MOU, MOAs, or LOIs. In section 2, in the population of focus, it'll require a narrative about the region served and the community needs, and then fill in information as well. In section 3, the program design and services, it requires a narrative about the design and services, and then data for those proposed services. In section 4, pardon me, management and sustainability, it requires narratives about the organizational structure, quality assurance, and financial management of the organization. Section 5 is the proposed budget on Excel. And then let me see, next one. For the capacity building only grants, capacity building will have a very similar application, but the applicants will respond to the questions as they specifically relate to the proposed capacity building project. So it's the same components, just the points are put a little bit differently. And then for the previous YOR grantees, you will be required to answer an additional question or questions related to the lessons learned and the quality improvement for the following year. I will now be passing the next portion of the presentation to Amanda, who is a program associate for YOR California.
Hi, everybody. Good morning. I just want to note it is definitely encouraging to be here with you today to see a lot of participants, but also a lot of questions. So I think the fact that we're seeing questions, that means a lot of you have started the application process. Maybe some of you that are on here, you're probably still getting a little more familiar with it. So what we're going to do right now is just kind of run through that a little bit if you haven't really looked at the online application. So we have here, so I'm going to stop. I'm going to share my screen really quick. And is this? So we're going to kind of run through the application, the PDF. I know you've seen it on the RFA at the bottom. These are the sample questions. Just one thing to know is, I'm sure right now a lot of us are working online, so there might be some possible internet glitches. So a tip that I just want to add is when you're looking through the RFA, even for the budget, and even this, the application questions, it's good to download, and then that kind of gives you time to run through the questions. There are sections, as you've noticed, that are more of the narrative boxes. Let me see if I can find one here. But there are narrative boxes, so you might not have if you're like on a time crunch, it's good to kind of do it on a Word doc. And then when you're on the online application, you can just transfer your answers. So that's just a tip in case for whatever reason, I know it's happened to me, the internet goes out or it slows down and you just want to submit, just kind of have that on the side as a, back pocket trip. And also one thing to be mindful of on the application, there is a word count limit. So in the application, you'll see like 300 words, 250 words. When I ran through the application, I noticed that if I went over like the cap was 250 and I went over 252 word count, it didn't let me move on to the next section. So that might be helpful for you who are going through the application and maybe you wrote a lengthy answer for one. If it's as long as it's under the actual word count, you should be good. But also we want to be mindful of time, right? So just something to consider as you're going through that. And another thing to also be mindful of is, so here you'll see optional 100 words, 150 is to answer all the questions. I say that because that happened to me. I was going through answering some questions just to see the test and it would kick me back and I missed like 2 sections. So that's just one thing to consider. Again, this is just more tips as you're going through the the application to think through. Another resource or tool that we want to offer is there is on the RFA, if you notice, there are videos on how to complete the application. So if you just click here, depending on how you're applying, if you were previous YOR 1 or YOR 2 grantees, this video here will kind of run through that the questions on how it would look as a YOR 1 or 2, previous YOR 1 or YOR 2 grantee. If you are applying as a capacity building or implementation grantee. It's on the RFA website, so I'm just going to kind of glance through this a little bit, but that is a resource for you all. So it kind of goes through the step-by-step process, creating your name, the name of your application, and so here, if you're applying as a capacity building or YOR 1 or YOR 2 grantee, the application will look different. So I just want to kind of note that. And then so we're kind of running through. Yeah, so if you notice the sections here, you want to make sure you complete and answer all the questions because you don't want what happened to me to happen. And then these are the narrative boxes, PDFs. So I just wanted to touch on the end part of once you complete it. So this runs through. So this is the application summary. So it'll give you an opportunity to review your application. If you noticed that there was a part, I kind of want to add a little more to that or change my answer. There is here at the top right-hand corner, you'll see these 3 dots. And you'll just click edit, and then you can reopen your application and go back to the section that needs the editing. And then you revise as you see, and then you can go back to the application summary and click submit. And also right before you click submit, there is a page, an attestation page. So just make sure you mark, you check the boxes right before you click submit and you send it over to us. So this is again a resource for you. I know I kind of went through it really quick, but if you kind of want to kind of chew on it a little more, these resources are available for you on the website here. And then now what I'm going to do is I'm going to pass it to Victor, and he's going to be going through the budget template.
All right. Thank you, Amanda. Let's see. Could you go to the first tab, summary?
Yes.
Okay. I'm going to walk through this fairly quickly with some, but on row 11, contact person, that's going to be the person that we talk to about the proposal. If we have any questions, whether it's about the program or the budget, if we'd like to schedule, as we say in RFA, it's not necessarily, but we may do with some grantees, we want to schedule an interview to talk to the executive director. That's the person who's got to be able to field all the questions we may send their way. Further down, you see the federal tax ID number. That's pretty straightforward. The facility NPI, if you're a treatment agency, you will or should have one. The federal unique entity identifier, that used to be the DUNS number, and that's we have a link in the RFA instructions about how you get one if you don't have one. That's something we need. As you may have gathered from some of the preceding presentations, this is a federal grant. There are a lot of reporting requirements, and this is connected to some reporting requirements. And in row 18, what's your total budget for the last fiscal year? And that's going to give us a sense of your size and ability to, one indicator, of your ability to actually do what's proposed. And then finally on row 29, now, as I mentioned in the instructions, all the highlighted cells, in this case yellow, are calculated. There's a formula in there. And I should say at this point, none of this is protected. This is to give you flexibility to, provide, maybe insert some rows or make other minor changes. It also gives you the flexibility to destroy the spreadsheet. So I say, use this at your risk. But the one cell that gets filled out here is your indirect costs, and you just put the number in there, whatever it is. Everything else will be brought forward from what you enter on the next tab, which we'll go to right now, titled Budget. So we have two sections here. There's personnel. That's divvied up between administrative and support staff. And these are the folks who run the organization. The administrative, fiscal, administrative support staff, et cetera. In section C, these are direct service staff, and these are the people who are doing the face-to-face interactions with your clients. I say face-to-face, that can be virtual or in person. The yellow highlighted cells are calculated. You put in the FTE, the hourly rate, and it's going to calculate the amount for the grant, the 14-month grant period. There's we had a question come in earlier about what's that 2440 mean? Well, that's the budgeted FTEs for a 14-month period, 2,000 FTEs for 12 months, and it's 2440 for 14. Like I say, these are calculated automatically. And Amanda, if you can scroll down a bit, you've got in the services and supplies, we have a drop-down boxes for listing approved categories for a number of line items there. If you've got something that's not on there in the drop-down, well, I'll show you where to put that in, but you can still add those as well. And all the budgets are subject to Department of Healthcare Services approval, just to make sure that all costs are allowed under the terms of the grant. And again, a link to what those federal requirements are is provided in the RFA. So here's so you can add stuff that's not in the dropout list. You got we got 1, 2, 3, we have 5 rows, let's say. And if you wanted to, if you had 6 or 7 items, you could add a row in that section, and it's not going to break the spreadsheet. So that's the same thing we get down to subcontractors, whether it's business entities or self-employed individuals. Again, a question came in here. These are people that you contract with to do, some program activities. So this could be, if you're not doing MAT yourself, but you have an agreement with a local community clinic to do so, they might show up there. For self-employed individuals, generally speaking, consultants, it could be somebody who comes in to do clinical supervision, somebody who maybe assists with an outreach plan or social media strategies, that kind of thing. So we just do that to distinguish between the individual consultants versus larger business entities. You know, if they have a taxpayer, an employee identification number, they go into business entities. If we're working off of Social Security, it's individuals. And then you get the totals come down at the bottom. Next, please, then, Amanda. So we'll go then to the narrative, and okay, there we go. And no surprise, all these cells here are calculated. All this stuff gets brought forward from what you enter in the budget page. The calculations, at least for personnel, are all done for you in the spreadsheet. However, with the justification column, it's like, okay, so why are these people in the budget? You know, now administrative staff, sure. You know, maybe you need to have a medical director, you got your executive director, you know, your finance people and all that. But to, you know, indicate why they're assigned to the basic thing here is why they're assigned to this project at the level that they're budgeted for. Similar thing down for direct service staff. You know, what do they bring to the to the table? There are these counselors, outreach workers, you know, you name it. And, you know, so what is their role in the project? Then we get down all the expense categories. In this case, you will discuss the calculation. You can expand the cell to do so. Same for the justification. And so the calculation is, you know, office space. You know, we're charging, you know, X dollars per square foot for so many FTEs, and it equals whatever. Printing, copying, that kind of thing, you know, so many. Justification, what is, well, for some stuff, typical business expenses, office space, et cetera, well, that's, you know, just, they got to sit someplace. Other things that more program related generally would be, you know, program supplies. So you're going to buy, are you proposing to buy art supplies or some items for your furniture for your drop-in center or whatever? Now, like I say, all this stuff is under DHCS approval, but if other things like that generally tends to be, you know, there's a distinction. You can always send us another question once you get into it, between business-related services and supplies versus program-related. Same thing here for contractors. You know, what's the calculation here? You're paying them, this is a total, you're paying them on a hourly rate. Total, you're paying them for a product. Somebody's going to do a social media plan for you, and the full cost is, you know, I don't know, $1,000, and that's, you know, due. So again, what's the basis for payment, and then what exactly are they doing, and why is that important? Lastly, down here on row 67, your indirect costs, and here is where you would we list this, that it's either you've got a federally approved rate, and you could put that into your calculation or justification. You know, it's calculation that's X% of total or modified total direct costs. And then in the justification, either that's your basically de minimis 10% that you just charge, you know, regardless. Or if you have a federally approved rate, what that rate is, and attach that approval letter. We got a question came in earlier from one organization that said, well, we got two different rates. Well, fine, tell us about it here. You know, we want one number back on the budget page, but if you've got, you know, different rates for different types of staff, then explain it here. So that's all for the budget. Thanks, Amanda. I just want to give you a quick walkthrough there. And now I think I've actually got some slides too. Okay. Can I advance these? Okay, whoop, a little too far. So, okay, so anyway, so read in the instructions what's allowable and not allowable, and check out the links there, because that's important. You don't want to spend the time to build something into your program and into your budget, then find out the feds won't pay for it. Use the template that's downloaded from the YOR California website. I've already talked about this, about the highlights. Administrative versus direct staff. I think I've explained that, who runs the business, who interacts with the clients from programmatic perspective. So the receptionists, they interact with clients all the time, but they're more administrative and not direct service. Service and supplies. The complete list, yes, is in the RFA. So if you want to, in that section for extra costs, you can add something that's on that complete list that's in the RFA. There's some things, the ones that are picked. We got this from the study on nonprofits expenses, and these are the most commonly reported. But you might have something that's different. Then the subcontracts, the distinction between a business entity and the self-employed individual. I think the key test there is, will they be reporting to you an employer identification number or a social security? It's 1099 versus a business expense. And then the indirect costs. As I said, it's, be sure to include your federal approval letter if you're charging more than 10%. And then the justification, I kind of went over that, about what's the math that supports the number, basically. The justifications, for standard expenses, what's the allocation of cost to the YOR project? If we're going to give you $500,000 and you're already $1 million project, we would expect to get about a third in that ballpark, of a total organizational budget of 1.5 million. So we want to make sure that that's, not excessive. The project related expenses, why is it important? Whether it's printing, program supplies, whether it's videos or all kinds of things, client transportation, staff mileage, basically the thing is, why is the expense important? And subcontracts, what do they bring to the party here? And again, indirect, as I described. So that's it for mine. So I'm going to piece of this. I will turn this back to Deb at this point to sort of bring us into the questions and answers. So thanks very much. And here you go, Deb.
Great. Thank you, Victor and Amanda and Lala for the overview kinds of pieces. I'm just going to quickly share with you, this is the timeline. So we've released the RFA. Today we're having this webinar. We will be posting the recording of this webinar along with some questions and answers onto the website. When that happens, anybody who has registered for this session or who has submitted a letter of intent will also receive that notification. On December 29th is the last day to submit questions. We do ask that everybody submit a notice of intent, even if you're not 100% sure you're applying. If you think you are, it'll take you 5 minutes and it really helps us in terms of our planning. The application deadline is January 19th, and we're anticipating making award announcements on March 4th. So that's the timeline that is also available in the RFA. There have been some questions that have come in. I'm going to remind everybody to go ahead and continue to put your questions into that question box. You can also email your questions to yourcalifornia@ahpnet.com up until December 29th. The sooner you get us the questions, the sooner that we'll be able to answer them. And like I said, some questions we can't answer right away. We have to check. Oftentimes we'll also check with DHCS to make sure that something is allowable. Some of the questions that have come in, I'm going to just quickly run through and give some answers because they are questions that are built into the RFA already. The first one of these questions is, can this funding be used to support existing services or is it for new programming? So your California funds cannot supplant or duplicate existing funds for resources. You could be so you could be creating brand new programming as a part of this. You can also be expanding the reach to additional populations. But if you have an existing program with existing funding, you could not just stop that funding and start charging YOR California for it. So it cannot duplicate or supplant. Next question that actually a couple of different people have asked, and I think this is because in some programs, each separate site submits a separate application. That is not true for YOR California. So the question, can an agency submit two separate applications for two different site locations? What we are looking for is YOR California programs. So it isn't necessarily based on your site. If you have two different locations that you're going to be reaching and serving youth, but your outreach is combined and you're serving, as your focus is on one particular county, then having both of those locations would be as a part of one application. If you have a program in Del Norte County and a program in Imperial County, and they're going to operate completely separately from each other, because your stakeholders are going to be different, the youth you are reaching are going to be different, that would require two separate applications. So I hope I clarified that. We also have had a couple of people who are interested in capacity building who've already looked at the RFA, who've asked a couple of questions about some of the questions seem to be very direct service related, particularly in the table. So I would say if you have a 0 on something that is, I think there's a question around outreach activities for youth. If you're not planning on doing that as a part of it, that is absolutely fine. Go ahead and make notes of that and provide in the descriptions what it is that you are going to be doing. We are expecting that capacity building programs also do have some sort of youth advisory. So make sure that you are speaking about that. But providing community education and outreach is not a requirement of the capacity building grantees. We've just noticed that many capacity building grantees do that kind of work as well as outreach work. So that's why that has been put in there. So describe your program as accurately as you can. We also have had a question because one table asks for a snapshot of your demographics for the month of October 2022. If your demographics, if you compute them annually instead of by a month, I would suggest you could do your best to kind of make note of that and provide 1/12 of that number in terms of that month of October, or provide some sort of description. What we're looking for is some information about your current experience working with youth and the demographics of the youth that you're working with. We have a question. Are we required to provide participants with SUD treatment if we are an implementation grant? And the question, is access to MAT a required deliverable? Access to medications for addiction treatment is a required deliverable for implementation grantees. For capacity building grantees, we would be assuming that you are building the capacity so that youth have access to MAT if they don't currently have that access, or helping to make those links. So I would say the answer to that is yes. In terms of SUD services, that also we would really be expecting, you may not be delivering them yourselves, but remember that your service model for an implementation grantee, how you are providing some of the family supports, recovery supports, behavioral health counseling elements as well, would be is also an expectation for implementation grantees. Somebody noted that there was a typo related to the age range on one of the slides. Just to confirm, the age range for YOR California, YOR California is focused on youth ages 12 to 24. Someone else asked whether you have to serve all youth in that age group, or if you can pick a segment. You can pick a segment. So it could be, if you're only serving youth who are 18 to 24, make that clear and describe that. Many organizations are serving youth 16 to 24 with specialized services for youth who are under the age of 18. Another person asked a question that kind of goes with this a little bit about that it sounds like I was trying to go downstream to selected and indicated prevention. I'd say when we're talking about going further downstream to those people who yes, they need prevention in terms of sort of resistance skills, but we're also, this is focused on providing services for youth who currently have problems with opioids and stimulants. So thinking about the kinds of treatment services as well as those pieces that bolster their resilience would be a part of that. So those questions. Someone asked if hospitals are eligible, and the answer to that, the criteria is not meant to be exhaustive, but if they're eligible to do business in California and they're nonprofit or for-profit, a hospital would be eligible. We have had hospitals as YOR 1 and YOR 2 grantees in the past. Another person asked, can we focus on policy change? For example, youth advisory groups preparing statements for local policymakers around SUD access. And I would say that that is definitely a part of a capacity building project, is helping to create the policy changes that are necessary to help support youth to address opioid and stimulant misuse. Another question, somebody asked, I've somewhat answered this, but I'll go back to it. For an implementation grant, may an applicant subcontract to provide the MAT and other formal addiction treatment services, while the lead grantee provides outreach, warm connections, and ongoing treatment adherence support? And the answer to that question is yes. You want to make sure that in your proposal, you are clearly describing how that partnership is going to work and how you're going to be integrated together in the delivery of the YOR program. Someone else asked whether the GIPR requirements was true for every grantee or only those that provide SUD treatment. We will provide an additional answer in writing, but all implementation grantees should have some individuals they are serving who will require a GIPRA. And GIPRA does not apply to capacity building, only grantees. Somebody else asked, and I think I've already answered this, can this funding be used to support existing services or is it for new programming only? These funds cannot duplicate or supplant existing funds. And also YOR California funds are really supposed to be funds of last resort. So, if somebody is eligible for Medi-Cal and Medi-Cal will cover the costs of their treatment services, that is the source that should be billed first, and then move into these funds. Would the grant be limited to recipients who are on drug Medi-Cal, or would we be able to serve any population between 13 and 24 years old? The focus again is youth who are misusing opioids and stimulants. So you'll have to make sure that they meet that criteria, but this is not limited to individuals who are enrolled in drug Medi-Cal. And somebody else asked, they said, I'm still unclear between the difference between YOR 1 and YOR 2 and the other applications. So let me do a little bit of clarifying on that. The application that is attached to the RFA is the sample of the implementation grantee application for new applicants. For if you are currently a YOR 1 or 2 applicant, you will complete all of those questions, but you will have some additional questions specifically about your lessons learned and your services under the YOR 1 or YOR 2 program. And then the scoring is a little bit different. So that, I think that will look clear. If you watch the videos that Amanda has made that are available on the website, you'll also see how the questions are a little bit different. But mostly it's that you'll have some additional questions if you've been a YOR 1 or YOR 2 grantee in the past around your lessons learned, and then there will be something different with that. Victor already talked about if we have a federally approved indirect cost rate of 15%, can we use that? If it is a federally approved indirect cost rate, it is current, you can use that, and then you attach a letter. Somebody asked, would grant writers need to be included, not directly related to program activities? I don't think that you probably would have grant writers included in the staffing for your YOR California project. And just to be clear, we cannot pay for your development of this application. And I think those are the questions that I have easy answers to. And that's good because we're also just about out of time. And I will just take a moment to say thank you to you all. We are very excited to see your applications, and we are looking forward to partnering in the development of the YOR3 program.